This joint is throbbing with pain. It is red. It feels warm. It's going to be hot to touch. It's going to be extremely painful, so painful that my patients often say that when they get gout attacks like this, they can't even let a sheet touch their joint because it causes excruciating pain. Write in the comments if you've ever had gout or know someone who has. You know what I'm talking about. Guys, I'm Dr. Jen. It's good to see you. Make sure you subscribe for more. We're talking about gout attacks today, and I'm going to tell you what causes them, where they happen, how to treat it, and more. I also want you to make sure you watch to the end of the video because I'm going to show you some images of what can happen if someone has repeated gout attacks, and you're never going to believe this. So first of all, gout. It's a form of arthritis, okay? We think about arthritis, it causes pain and swelling in the joints. Now, gout occurs in some people who have high uric acid levels in the blood. When you have gout, this uric acid forms crystals that build up in different parts of the body and cause the symptoms, these sort of gouty attack symptoms, the joint swelling and the pain. Now, not everybody with elevated uric acid in the blood will develop gout, okay? Now, some of you have asked me before if kids can get gout, and the truth is that gout usually develops in adults. It's very rare in children. It tends to happen earlier in adult males, like between the ages of 30 and 45. Females, it's usually after the age of 55, and it's particularly common in people older than 65, regardless of whether you're male or female, okay? About 4% of adults in the United States will experience gout attacks. Now, you're probably wondering, what's causing this? Why am I getting this? Well, we talked about the increase in uric acid level in the blood, but there are also lifestyle changes and lifestyle factors that can contribute. Obesity may contribute, chronic kidney disease, foods, what you eat and drink, excessive alcohol, beer and spirits in particular on a regular basis, consuming large amounts of meat or seafood. And by the way, I'm going to link a video here on the full range of foods that could trigger gout attacks. I want you to take a look at that video after this one, okay? If you don't see it, if you're watching on Facebook, just message me for it. Certain beverages, which are syrupy or sweet. There are some medications that can precipitate gout attacks, like water pills. Some forms of water pills can do it. And then things like dehydration or surgery, even starvation can sort of precipitate a gout attack. There are other risk factors as well, but that's some. Now back to these joints, all right? It's not just the big toe, which is what I've been showing you, but this is a very, very common joint to get a gout attack. Again, affected joints are tender, they're painful, they're swollen, and typically gout flares affect a single joint, okay? Now, sometimes a person can get several joints at the same time. That's not typical, I should say. Gout flares often, and usually in my experience, occur at one joint, like the knee, a finger, the big toe. And something I think is really interesting is that gout flares can really occur at any time of the day, but it most commonly occurs at night and in the early morning. And this makes sense because usually when I get calls from my patients saying that they have a flare-up of gout, it's usually first thing in the morning that I'm getting that call. Before I go into treatment for acute gout attacks, I want to show you what can happen if a person has gout attacks that happen over and over and over and over and over again. This is called chronic tophaceous gout. You can see there literally is disfigurement and large sort of bulky nodules on the joints. It's really important if you have gout attacks to not suffer through it, to not sort of, get through it without your doctor's advice. You need to see your doctor to make sure that we are treating you optimally, trying to prevent these gout attacks and keeping your joints from becoming disfigured. Now let's talk about treatments for acute gouty attacks. Like what are we going to do for it in the doctor's office? Well, we're going to give you anti-inflammatories. That's sort of the mainstay of treatment for gout attacks. Things like NSAIDs, non-steroidal anti-inflammatory drugs, colchicine or steroids. It's really important to treat your gout attacks. They likely will go away on their own if you don't. You're going to be in a lot of pain, so get these things treated. Also, you want to work with your doctor to see if you qualify for what we call preventative medications. Gout, what I'm telling you about in terms of gout attacks is just sort of the tip of the iceberg. Make sure you're being treated comprehensively. Write in the comments if this has ever happened to you or someone you know. I'm Dr. Jen. Please subscribe to my channel. Follow me on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp. Also check out my other videos on gout and other types of arthritis. Sign up for my free health newsletter at drjencaudle.com. I'll see you soon.